Using AI and surgical gestures to predict outcomes. This is Andrew Hung. I'm Associate Professor of Urology and Computational Biomedicine and Vice Chair of Academic Development in the Department of Urology at Cedars Sinai Medical Center, Los Angeles, California. These are my disclosures. My team has used surgical video to decode the sequence of surgery, similar to the genomic code as represented by DNA in humans. We are able to decode the sequence of surgery using gestures such as cold cut, retraction, peel, and hot cut. In total, we have about a dozen of these gestures that we have now used to decode a full sequence of the nerve spare step of the prostatectomy. Here are individual rows, each representing a different patient undergoing this operation, and each cell represents one of those gestures. Now, these patients represented here are those who, while they had sexual function before surgery, do not recover that function 1 year after surgery. In contrast, these additional rows representing additional patients are those who do recover function 1 year after surgery. This is an operation that we have been doing for many decades, yet we have not been able to reliably anticipate whether or not the patients will recover function or not. If you use traditional analytic means, we can identify that using the peel-push gesture, a blunt maneuver, is favorable for 1 year recovery of sexual function. Conversely, using hot cut or energy during a cut is not favorable for recovery 1 year after surgery. We looked at 80 radical prostatectomies and we included the gesture sequences, approximately 34,000 individual gestures that we studied, plus the clinical features, to see if we can use this information to predict 1 year erectile function recovery. We gave this data to 2 teams to construct machine learning predictive models. One team utilized a neural network. The other team utilized a logistic regression, and they were given the data to work on independently to compare the reproducibility of our results. What we found was that Team 1, again using the neural network, received an AUC of 0.69 in its model's ability to anticipate erectile function using clinical data alone. Using gestures alone, they were able to anticipate the outcome with an AUC of 0.77, and combining both the patient features and the gesture sequences, they achieved an AUC of 0.75. Team 2, using the logistic regression model, were able to achieve an AUC of 0.65 using the clinical features with the gesture sequence 0.68 and combined 0.67. While the ability of the patient factors were not the most critical in anticipating the outcome, these were the most important ones based on their relative importance. The final pathology Gleason score or grade of the cancer was most important, followed by age, the body mass index, the PSA, which is a biomarker for prostate cancer, and finally, the size of the prostate being removed. But it's not good enough to predict a good outcome. We also want to change the behavior of the surgeons, if necessary, to optimize outcomes. Here is one patient who recovered function at 1 year after surgery. So in addition to anticipating the outcome for this patient, our AI models are able to identify the sequences or specific series of gestures that are protective of that good outcome. And in contrast, in a patient who does not recover function at 1 year, we'd like to identify the gestures that were most harmful to the patient's eventual outcome. Here are our take-home messages. With 80 radical prostatectomy patients, we've utilized their gesture sequences to train and predict patient outcomes. Surgical gestures are indeed the building blocks of surgery. In fact, it is an objective way of measuring the quality of surgery, and this can be extended beyond the nerve spare step of the prostatectomy. With our AI models, gestures can be utilized to anticipate patient-reported outcomes. As you see here, our AUC was achieved up to 0.77. And further AI models can be used to help identify areas of improvement for our surgeons so that they can perhaps improve the quality of their patients' lives after surgery. Thank you.